understanding cholesterol levels and their impact on health. Welcome back to our channel where we delve into the truth about high cholesterol, dispel myths, and share strategies for fighting diabetes and heart disease. Today we're setting the stage for a critical discussion on how cholesterol levels can significantly impact our health. Cholesterol is a waxy, fat-like substance found in every cell. While our bodies need cholesterol to build healthy cells, too much of it can lead to serious health issues, such as heart disease and stroke. Understanding cholesterol's role in our bodies and how it can affect our well-being is crucial. One common misconception surrounding high cholesterol is that it only affects older individuals. However, the truth is that high cholesterol can develop at any age, making it essential for everyone to monitor their levels regularly. Another myth is that all cholesterol is wrong. But the reality is that there are both good, HDL, and bad, LDL types of cholesterol, and it's the balance between the two that matters most. The link between high cholesterol, diabetes, and heart disease is undeniable. People with diabetes are at a higher risk of developing high cholesterol, which can further increase their chances of heart disease. Diabetes can also lead to a condition called diabetic dyslipidemia, where cholesterol levels become imbalanced, putting individuals at even greater risk. Understanding the connection between these conditions, we can proactively manage our cholesterol levels and reduce our risk of heart disease and other complications. The upcoming videos will explore practical strategies for lowering cholesterol, controlling diabetes, and improving heart health. Stay tuned as we uncover the truth about high cholesterol, debunk myths, and empower you with the knowledge to lead a healthier, happier life. Let's take charge of our health together. Understanding cholesterol. Cholesterol is a vital substance that plays a crucial role in our bodies, but it's essential to differentiate between the two main types: LDL, bad cholesterol, and HDL, good cholesterol. LDL cholesterol is often referred to as bad because high levels can lead to the buildup of plaque in the arteries, increasing the risk of heart disease and stroke. On the other hand, HDL cholesterol is known as good because it helps remove LDL cholesterol from the bloodstream, reducing the risk of heart disease. When LDL cholesterol levels are elevated, they can significantly impact heart health and overall well-being. The buildup of plaque in the arteries, known as atherosclerosis, can restrict blood flow to the heart and other vital organs, increasing the risk of heart attacks and other cardiovascular events. High cholesterol levels can also contribute to hypertension, another risk factor for heart disease. Maintaining healthy cholesterol levels is crucial for overall health and well-being. Simple changes to your diet and lifestyle can help lower LDL cholesterol and raise HDL cholesterol levels. Incorporating heart-healthy foods such as fruits, vegetables, whole grains, and lean proteins can help reduce cholesterol levels. Limiting saturated and trans fats, refined sugars, and carbohydrates can positively impact cholesterol levels. Regular physical activity is another critical component of maintaining healthy cholesterol levels. Exercise can help lower LDL cholesterol, raise HDL cholesterol, and improve cardiovascular health. Aim for at least 150 minutes of moderate intensity weekly exercise, such as brisk walking, cycling, or swimming. By understanding the different types of cholesterol, their impact on health, and how to maintain healthy levels through diet and lifestyle changes, you can take proactive steps to protect your heart and overall well-being. Stay tuned for more tips and strategies on managing cholesterol and improving heart health. Dispelling myths. Myths and misconceptions often abound in health and wellness, especially regarding high cholesterol, diabetes, and heart disease. Let's debunk some common myths and provide accurate information so you can make informed decisions about your health. One prevalent myth is that all cholesterol is bad. In reality, cholesterol is necessary for our bodies to function correctly. It's the balance between good, HDL, and bad, LDL cholesterol that matters most. HDL cholesterol helps remove LDL cholesterol from the bloodstream, reducing the risk of heart disease. Understanding this distinction is crucial for managing cholesterol levels effectively. Another myth that needs debunking is the belief that diabetes cannot be prevented. While some risk factors for diabetes, such as genetics, cannot be changed, lifestyle modifications can significantly reduce the risk of developing type 2 diabetes. Healthy eating, regular exercise, and healthy weight are critical factors in diabetes prevention. Scientific evidence refutes false claims about cholesterol and diabetes, highlighting the importance of understanding the link between these conditions and heart disease. High cholesterol levels can increase the risk of heart disease, especially in individuals with diabetes. Managing cholesterol levels through diet, exercise, and medication can help reduce this risk and improve overall heart health. Empowering viewers with accurate information is essential for making informed decisions about their health. By dispelling myths and providing evidence-based knowledge, we aim to equip you with the tools to take control of your well-being. Stay tuned for more insights and strategies for managing high cholesterol, diabetes, and heart disease effectively. Remember, knowledge is power when it comes to your health. Let's work together to separate fact from fiction and pave the way for a healthier future. Managing diabetes. Living with diabetes requires a proactive approach to managing the condition and maintaining overall health effectively. Let's explore some key strategies for managing diabetes, including diet, exercise, medication, and monitoring blood sugar levels. A balanced diet and regular physical activity are essential components of diabetes management. Eating various nutrient-dense foods, including fruits, vegetables, whole grains, lean proteins, and healthy fats, can help regulate blood sugar levels and support overall well-being. Monitoring carbohydrate intake and spacing meals throughout the day can help stabilize blood sugar levels. Physical activity plays a crucial role in diabetes management by improving insulin sensitivity and helping control blood sugar levels. Aim for at least 150 minutes of moderate intensity weekly exercise, such as brisk walking, cycling, or swimming. Strength training exercises can also help improve muscle mass and enhance glucose metabolism. Medication and insulin therapy may sometimes be necessary to control blood sugar levels effectively. Oral medications, injectable medications, and insulin therapy can help regulate blood glucose levels and prevent complications associated with diabetes. Working closely with your healthcare provider to determine the most appropriate treatment plan for your needs is essential. Monitoring blood sugar levels regularly is critical to managing diabetes daily. Tracking your blood glucose levels and other vital signs, such as blood pressure and cholesterol, can help you make informed decisions about your health. Additionally, staying informed about the signs and symptoms of high and low blood sugar levels can help you take prompt action when needed. By incorporating a balanced diet, regular exercise, medication as prescribed, and diligent monitoring of blood sugar levels, you can effectively manage diabetes and lead a healthy, fulfilling life. Stay tuned for more tips and strategies on diabetes management and overall well-being. Preventing heart disease. Heart disease is a leading cause of mortality worldwide, but the good news is that many cases are preventable through proactive lifestyle changes and preventive measures. Let's explore how individuals, especially those with high cholesterol and diabetes, can reduce their risk of heart disease and promote heart health. Smoking, obesity, and a sedentary lifestyle are significant risk factors for heart disease. Smoking damages blood vessels, increases blood pressure, and raises the risk of heart attacks and strokes. Obesity puts strain on the heart and can lead to conditions like high blood pressure and diabetes. A sedentary lifestyle contributes to weight gain, weakens the heart muscle, and increases the risk of cardiovascular problems. Quitting smoking, maintaining a healthy weight, and staying physically active are crucial steps in preventing heart disease. Creating a heart-healthy diet and exercise plan is essential for reducing the risk of heart disease. A diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats can help lower cholesterol levels, control blood sugar, and support heart health. Limiting saturated fats, trans fats, sodium, and added sugars can further reduce the risk of heart disease. Regular exercise, including aerobic activities, strength training, and flexibility exercises, can improve cardiovascular fitness, lower blood pressure, and reduce the risk of heart disease. Regular health checkups and screenings are vital for early detection and prevention of heart disease. Monitoring cholesterol levels, blood pressure, blood sugar, and other vital indicators can help identify risk factors and allow timely intervention. Working closely with healthcare providers to manage chronic conditions like high cholesterol and diabetes can also help prevent complications and reduce the risk of heart disease. By addressing risk factors, adopting a heart-healthy lifestyle, and staying proactive about heart health, individuals can significantly reduce their risk of heart disease and enjoy a longer, healthier life. Stay tuned for more tips and insights on promoting heart health and preventing cardiovascular problems. We've emphasized the importance of understanding cholesterol levels and their impact on health, debunking common myths and misconceptions surrounding high cholesterol, diabetes, and heart disease. By differentiating between LDL and HDL cholesterol, exploring effective strategies for managing diabetes, and exploring preventive measures for heart disease, we've provided valuable insights to empower you on your health journey. Positive lifestyle changes are essential to improving health outcomes and reducing the risk of developing chronic conditions like high cholesterol, diabetes, and heart disease. By adopting a balanced diet, engaging in regular physical activity, managing stress, and staying proactive about health screenings and checkups, you can take control of your well-being and pave the way for a healthier future. We encourage you to apply the information in this video to your daily life. Remember, your health is your most valuable asset, and investing in it now will pay dividends in the long run. Suppose you found this video informative and helpful. In that case, we invite you to subscribe to our channel, like this video, and share it with others who may benefit from this valuable information. Thank you for joining us on this journey towards better health.